Cats are beloved pets in many households across the U.S. Unfortunately, wherever infected mosquitoes are present, cats are at risk of heartworm infection. A single bite by a mosquito carrying microscopic heartworm larvae can transmit this blood-borne parasite to any cat. From the subcutaneous site where they are deposited by the mosquito, heartworm larvae migrate through the body of their new host over a course of 3 to 4 months. Many will die during their journey, but those surviving eventually enter into the circulatory system, where they are forced into the pulmonary artery leading from the heart to the lungs. Most immature heartworm larvae die after arriving at the pulmonary artery. However, surviving larvae grow into adult heartworms, averaging 4 to 5 inches in length. As the adult heartworms age and are exposed to the cat's immune system, they eventually die. However, this can take 2 or 3 years, during which time heartworms can cause serious complications, including cardiac effects, thromboembolic disease, and even death. Most attention has previously focused on the effects of adult heartworm infection. New research shows that exposure even to heartworm larvae can be extremely serious. Extensive inflammatory complications caused by heartworm larvae, even if they do not mature into adults, can be highly damaging to pulmonary tissues. Larvae or adult heartworms in the pulmonary blood vessels can lead to blood vessel and lung damage over the course of months and years. The release of metabolic particles from worms and fragments of dead worms lodge in the cat's arteries and capillaries, and in the airways leading to the lungs. The capillary beds of the cat's lung contain pulmonary intravascular macrophages, or PIMS, specialized cells that engulf foreign materials. The PIMS eliminate the heartworm fragments and release cytokines. Inflammatory cells infiltrate the walls of the pulmonary blood vessels, causing a pronounced thickening of the arterial walls, which narrows the vessel interior. Enlargement of the pulmonary blood vessel walls creates intracellular gaps that cause them to leak fluid into the lungs. Inflammatory cells migrate into the walls surrounding the alveoli. This compromises blood flow and oxygen exchange, and thus greatly reduces the lungs' capacity and the cat's ability to breathe. It is possible for this activity to occur while the cat continues to test negative using conventional diagnostic tests. A first inflammatory cycle typically occurs when pre-adult larvae begin to die 3 to 4 months after infection. A second chronic cycle may occur after the adult worms begin to die over the next 2 to 3 years. Either inflammatory cycle can cause significant pathologic damage to the cardiopulmonary structures of an infected cat. Coughing, asthma-like signs, and respiratory distress often occur during each inflammatory cycle.